The prognosisnators pushing a last-ditch Obamacare repeal effort this week are up against the same old problem, math. This small group of Republicans, led by Louisiana Senator Bill Cassidy and South Carolina Senator Lindsey Graham, appear convinced they can rework the equation to secure that ever-elusive 50th vote for their measure, finally passing a bill overhauling the Affordable Care Act with a tie-breaking vote from Vice President Pence and moving closer to their goal of repealing and replacing President Barack Obama's health care law. There will be a lot of moving parts to watch this week. Republicans have asked the Congressional Budget Office to rush a score of the Graham-Cassidy bill, Senate Majority Leader Mitch McConnell's RKY office confirmed yesterday. McConnell plans to take the temperature of his leadership team and his entire conference over the next few days. They have only 2 weeks left to scrape together enough support, since the budget reconciliation bill they're using expires at the end of the month. But despite all the noise being generated on Capitol Hill, Cassidy and company still appear to be shy of the vote total they'd need to succeed. Cassidy says he's certain they have 48 or 49 Republican votes for his bill. But getting that final 50th vote is the crucial, and the hardest, part. Cassidy has sorta, kinda, maybe won over Senator John McCain, Republican Arizona, who said this month that he favors this latest approach but wanted to see actual text first. McCain is a key figure in all of this, since he cast the third vote in July bringing down a skinny repeal bill. But McCain has also continually expressed frustration at passing a healthcare bill entirely along partisan lines, and he reiterated that concern on CBS's Face the Nation yesterday. Why did Obamacare fail? McCain said. Obamacare was rammed through with Democrats' votes only. That's not the way to do it. McCain spokeswoman Julie Turallo told me the senator is continuing to review the text Cassidy introduced last week. Senator McCain continues to review the bill to assess its impact on the people of Arizona, she said. As he has said before, Senator McCain believes health care reform should go through the regular order of hearings, open debate, and amendments from both sides of the aisle. But even if McCain does sign on, his support would basically be zeroed out by Senator Rand Paul, RKY, who voted for the failed skinny repeal bill in July. But Paul said Friday he'd defect from Graham-Cassidy because it leaves way too much of Obamacare in place. The two, Paul and Cassidy, got into something of a Twitter fight on Friday. Paul tweeted this. Cassidy responded au contraire. Paul said if Cassidy ends up just swapping Paul's support for McCain's backing, he needs to net an additional vote from one of two other moderate Republicans, Senators Lisa Murkowski of Alaska or Susan Collins of Maine. That's a steep task, since both women voted against skinny repeal, which was a much narrower repeal bill that peeled away only small sections of the ACA. And all this is assuming no other Republicans defect, even though Graham-Cassidy includes steep Medicaid cuts, an idea that gave many Republicans serious pause in previous incarnations. Under Graham-Cassidy, total federal Medicaid spending would be cut 26% in 2026 and 35% by 2036, relative to spending projections under current law. Cassidy's bill actually goes way further than either the House or Senate healthcare bills in overhauling the ACA by essentially lumping its spending on ACA marketplace subsidies and Medicaid into block grants for states to cover people as they wish. Here's a useful explanation from the Center on Budget and Policy Priorities. States would essentially have to create a new health program between now and 2020. When the marketplaces and Medicaid expansion would be disbanded. If they choose, states can abandon the ACA's regulations on insurers to provide certain essential benefits and charge the same premiums to people regardless of their health status. This, too, has been a point of contention among some moderate Republicans. The Kaiser Family Foundation's Larry Levitt smartly put it this way, and then there's President Trump, who has said little publicly about Graham-Cassidy, even though he devoted several tweets last week to slamming Senator Bernie Sanders, of Vermont, for the single-payer plan he rolled out. White House officials plan to help whip GOP votes this week, per Politico, but Cassidy wants the president to put his own weight behind the bill, publicly. You wouldn't exactly pick up on all these obstacles from talking to Cassidy. As a gastroenterologist who was deeply involved in health policy in the House before joining the Senate in 2015, He wants to be known as the guy who led Republicans across the finish line on the Obamacare overhaul effort, eluding them. Graham and two other important Republicans, Senators Dean Heller of Nava,